My name is Johanna Hasseltine. I am a psychiatric mental health nurse practitioner. My background in psychiatry has been in the outpatient mental health setting. Mental health has been an area that I've been serving in for the past 5 years.
Hi, I'm Lindsay. I'm a mental health nurse practitioner. I've been an RN for about 20 years and just graduated with my nurse practitioner degree in August. I've worked in various areas of healthcare over the last 20 years, primary care, orthopedics, labor and delivery. I'm currently still a home health nurse. You have to support mental health in all areas.
I specialize in both child and adult psychiatry, so children ages 6 and above is typically what we would see, and then all the way through older adulthood and anywhere in between. The inspiration for getting into mental health for me has kind of been a slow progression over time. Experiences that I observed as a child really kind of opened my eyes to how mental health impacts not only the individual and the person, but it really impacts the family and the friends and the community that's around the individual.
Seeing various ages, all the way from kids to adults. I did serve in the Navy for 6 years, so veteran mental health is very important to me too. I think this service has the potential to benefit individuals and the whole community as a whole. Talking about mental health, having mental health access in general, normalizes the concerns that we see and makes us less afraid to talk about it and may help reduce the stigma.
Mental health is so important for not only the patient that's experiencing those symptoms, but then there's also the family or the community that's around them that also is walking that path with them. And so when we're treating the patient, yes, we're treating your immediate symptoms, but we're also treating the bigger picture. Our goal is that we're alleviating and ameliorating those symptoms so that we can get you to a point of maybe improving functional capacity. Maybe you're more involved with your family and your community now because you feel better. So the new mental services that we're offering is for children through adults. The process for that is to call, make the appointment. There will be some initial intake paperwork that we'll want you to complete. That just gives me a kind of a snapshot before the visit, so that then when we're in the visit, I can really take that usually around an hour time to visit, get to understand the clinical picture. What are the symptoms that you're experiencing? What's causing some maybe functional impairment at work or at home or in your interpersonal relationships? Also developing a little bit bigger clinical picture so that while we're not always just treating specifically the symptom that you're dealing with primarily, the reality is there's a whole picture that we're trying to treat as well, because the goal is that you are seeing symptoms dissipate, but then also feeling like you're thriving in life. Follow-up visits are typically a 30-minute visit where we're going to maybe follow up and see how's the medication working, if we prescribed medication, what are the coping skills that we maybe have talked about at a previous visit. Are we using those skills that we're working on? How are they working? Where can we improve upon that? Where are you still seeing symptoms present that we need to continue to try to manage and improve? So symptoms we would typically see, we expect kind of all of it. So you may be coming in for anxiety or depression, but we also would expect to see things like ADHD, autism, particularly in the pediatric population. Maybe there's behavioral concerns that are happening at home or at school that we want to visit on. We also are comfortable in treating some of the more acute symptoms, such as disorders like bipolar disorder, schizophrenia, schizoaffective disorder. The first thing that I would want to make sure that someone understands is if you're hesitant to come in and schedule that visit, I get it, I understand. It's hard to want to come and to someone, particularly a stranger, and tell them parts about our life that maybe we're working really, really hard to keep close to us so that other people don't see. And I think it's really important to know that my job's not to come in and sit here and judge you or your life or the choices that we've made, the ways that you're coping with what you're experiencing. My hope is that we can come together, talk about what you're experiencing, get to understand those symptoms and how and what they mean to your life. And then also just to understand that you're not on the pathway by yourself.
You're not alone in the feelings that you're having. Other people are having the same feelings. People you walk by in the grocery store, at the gas station, other people are having those same thoughts, those same concerns. Nobody wants to talk about them. The more we talk about it, the more we normalize it. It's really courageous to come in and seek help. It's not a weakness.
Perfect.